MOINA, baby.
Hey there, my fellow kaPTids. This is Eunice and my partner Nicole. If you're ready to further learn and explore the wonders of MOINA, then what are we waiting for? Let's start! For today, we are going to talk about the hands and the wrist. The references used for this episode includes Netters, Tortora, Brunstrom, and Kenham. Let's begin with the small muscles of the hand. First is the palmaris brevis, which is a small quadrangular muscle that is found in the hypothenar region. It originates in two specific points. First is the flexor retinaculum, and second is the palmar aponeurosis, inserting in the dermis of the skin in the palm. It is innervated by the superficial branch of the ulnar nerve. It provides for the action of corrugation of the skin in the palm to improve the grip. Let's move on to our lumbricals. These are the intrinsic muscles of the hand, and it is worm-like in appearance. This originates from the flexor digitorum profundus tendon and inserts in the extensor expansion of the second, third, fourth, and fifth digits. Innervation comes from the lateral half of the median and medial half of the ulnar nerves. These muscles flexes the metacarpophalangeal joints and extends the digits at the interphalangeal joints. To easily remember the actions of the lumbricals, let's try to shorten it into metflex, intex, metflex, intex. See, it's easier to remember it this way. Next is the palmar interossae. So the palmar interossae are the short unipennate intrinsic muscles of the hand. It originates from the sides of the shafts of all metacarpals except for the third metacarpal, and it inserts in the dorsal extensor expansion and the sides of the bases of the proximal phalanges except again for the third metacarpal. It is innervated by the deep branch of the ulnar nerve, and it provides for the action of adduction of the digits towards the center. Lastly, we have the dorsal interossae. So these muscles are the bipennate intrinsic muscles of the hand. Its origin lies on the adjacent sides of the shafts of the metacarpals, and it inserts in the proximal phalanx 2, 3, and 4. Its innervation comes from the deep branch of the ulnar nerve, and it works, or its action is abduction of the fingers from the center or the third finger. Both the dorsal and the palmar interossae flexes the metacarpophalangeal joints and extends the interphalangeal joints. Now, let's discuss the short muscles of the thumb. We have the abductor pollicis brevis, which is the most lateral and the most superficial muscle among the thenar muscles. It is located just under the skin, and it originates from the scaphoid, trapezium, and the flexor retinaculum, inserting in the base of the proximal phalanx of the thumb. Innervation comes from the median nerve C5 to C7 as well as C8 to T1. Next on the list, we have the flexor pollicis brevis, a muscle, short, broad, intrinsic muscle of the hand, coming from the flexor retinaculum and inserting in the base of the proximal phalanx of the thumb. It is innervated by both the median and ulnar nerve, and from the name itself, it flexes the carpo-metacarpal and metacarpophalangeal joints of the thumb. To easily memorize this action, we can term it as car-metflex. Next, we have the adductor pollicis, which is the triangular intrinsic muscle of the hand. It has two origins, which is first the oblique head originating from the capitate and the second metacarpal as well as the third metacarpal, while its transverse head originates only from the third metacarpal, inserting all the way to the base of the proximal phalanx of the thumb. Now, it is innervated by the deep branch of the ulnar nerve, and it is responsible for the adduction of the carpometacarpal and metacarpophalangeal joints of the thumb. For short, we can say car-met-ad. Lastly, for the short muscle of the thumb, we have the opponent's pollicis, which is a short intrinsic muscle of the hand. It originates from the flexor retinaculum and inserts in the shaft of the first metacarpal. It is innervated by the median nerve, and now it works for the opposition of the thumb.
Now let's talk about the short muscles of our little finger. We have three: the abductor digiti minimi, flexor digiti minimi, and our opponent's digiti minimi. So these three muscles are supplied by the deep branch of our radial nerve. So first, let's go with the abductor digiti minimi. So abductor digiti minimi is the muscle that originates from our pisiform and inserts into the base of the proximal phalanx of our fifth digit. So this muscle functions in abducting our little finger. So next we have our flexor digiti minimi. So this muscle originates from the hook of hamate and the flexor retinaculum, and it inserts into again the proximal base, the base of the proximal phalanx of our fifth digit. So lastly, we have the opponent's digiti minimi. So this muscle originates from the hook of hamate and the flexor retinaculum, and it inserts into the medial border of our fifth metacarpal bone, and it functions in opposition of our little finger. Here is an additional condition that takes place in our wrist area. So that is the carpal tunnel syndrome. So our carpal tunnel is a narrow passageway of median nerve, the tendons of flexor pollicis longus, flexor digitorum superficialis, and flexor digitorum profundus. So this is formed anteriorly by the flexor retinaculum and posteriorly by our carpal bones. So this syndrome takes place when the median nerve is compressed. So this causes pain, tingling, and numbness to our fingers.
And we're done! I am sure you have picked a lot of great information in our MOINA episode today. To make it better, we have prepared some tips or techniques that should be helpful for you when you're memorizing your MOINA. First, familiarize yourself with the anatomical arrangements of the placings of the muscles. This is important because it will help you analyze the origin, insertion, and action of the muscles. Second, create mnemonics that will be helpful for you. And third is to continue studying or applying what you have learned. It was amazing to discuss the MOINA of the hand and wrist compartments with you. Always remember to have fun in learning. See you next time. Bye!
Yeah, it's MOINA, baby.